I want you to think about the last time anyone actually sat you down and explained, specifically and clearly, what to eat for better blood flow. Not vague wellness advice about eating healthy, not a generic list of superfoods copied from 100 other articles, but something targeted directly at the exact vascular process your body depends on every single time you need a firm, reliable erection. If nobody has ever explained this to you in those specific terms, you are far from alone, and that gap in information is exactly why I wanted to make this video. In my years as a urologist, I've sat across from countless men over 60 who are genuinely eager for this kind of information, but almost none of them have ever received it in a clear, specific, evidence-based way. They've heard vague suggestions to eat more fruits and vegetables, which is true, but nearly useless without specifics, or they've stumbled across exaggerated claims online that promise miraculous results without any real science behind them. Today, I want to close that gap completely. I'm going to walk you through 3 specific fruits that have genuine peer-reviewed research behind them for supporting the exact vascular mechanisms erectile function depends on, explain precisely why each one works at a physiological level, and tell you exactly how much you'd actually need to see meaningful benefit. I'm Dr. Emily Carter, and I've spent over a decade as a urologist helping men understand what's genuinely happening inside their bodies without the hype, the exaggeration, or the vague generalities that dominate so much of this conversation online. Everything I'm about to share with you comes directly from clinical research, the same information I'd walk through with a patient sitting across from me in my office before we get into the specifics. If you appreciate this kind of direct research-backed conversation about men's health, I genuinely encourage you to hit subscribe and drop a comment letting me know where you're watching from. I read every single comment, and it helps me understand what matters most to this community. Now, let's get into it. Before I reveal these 3 specific fruits, I want to ground you thoroughly in why this particular topic matters so profoundly after the age of 60. Because understanding the underlying mechanism is what will make everything else in this video click into place and actually make sense, rather than feeling like an arbitrary list of foods to remember. An erection, at its core, is fundamentally a vascular event. It is not primarily a matter of willpower, attraction, or psychological arousal alone, though those certainly play a role in initiating the process. Physiologically, it depends entirely on your blood vessel's ability to relax on demand and permit a rapid, substantial increase in blood flow into the erectile tissue. This entire process hinges on a molecule called nitric oxide, produced by the thin layer of cells lining every blood vessel in your body, known as the endothelium. When your endothelium is healthy and functioning well, it produces nitric oxide efficiently in response to arousal signals, triggering the smooth muscle in your blood vessels to relax and allow that dramatic increase in blood flow that makes an erection possible. Here's what changes with age, and why this becomes increasingly relevant the older you get. As men move through their 50s, 60s, and beyond, this endothelium naturally becomes less efficient at producing nitric oxide, a well-documented process called endothelial dysfunction. This decline doesn't happen randomly or without cause. It's typically accelerated by decades of accumulated factors, fluctuations and elevations in blood pressure, chronic low-grade inflammation throughout the body, reduced physical activity, and simply the natural wear that occurs in blood vessels over many decades of use. This is precisely why nutrition specifically targeted at supporting this exact pathway becomes more relevant, not less, as you age. Your body's own natural production of nitric oxide is becoming less efficient right at the stage of life when you need it most, which makes external dietary support genuinely valuable rather than merely a nice-to-have addition. The first fruit I want to walk you through is pomegranate, and I want to start with this one specifically because it has some of the most targeted, specific clinical research behind it of any fruit that's been studied for this exact purpose. This isn't a fruit that simply shows up in general nutrition advice and gets loosely associated with health. It has been directly studied in clinical trials specifically examining erectile function as an outcome. Pomegranate is exceptionally rich in polyphenol antioxidants, compounds that are considerably more concentrated in pomegranate than in most other commonly consumed fruits. Several clinical studies have specifically examined pomegranate juice consumption in men experiencing erectile difficulty, and one frequently cited trial found genuinely meaningful improvement in erectile function scores among men who consumed pomegranate juice daily over a period of several weeks, compared to a control group receiving a placebo beverage. This wasn't a subtle, marginal difference buried in statistical noise. It was a measurable, clinically noted improvement that researchers felt confident reporting. The proposed mechanism behind this benefit centers specifically on pomegranate's remarkably powerful antioxidant content, which helps protect nitric oxide from oxidative breakdown once it's produced. This detail matters enormously because nitric oxide is a genuinely fragile molecule with a very short half-life in your bloodstream. It gets broken down quickly by oxidative stress. the same kind of cellular damage caused by chronic inflammation, poor diet, and normal aging. Pomegranate's antioxidant compounds help slow this breakdown process, allowing more of the nitric oxide your body does produce to remain available and active long enough to actually trigger the vascular relaxation response an erection depends on. Alongside this protective effect, regular pomegranate consumption has also been associated with modest measurable improvements in overall endothelial function itself, meaning your blood vessels become somewhat more responsive and efficient at producing nitric oxide in the first place, not just better at preserving what's already there. Based on what's been used in the supporting clinical research, I generally recommend roughly 8 ounces of pure pomegranate juice daily, and I want to emphasize the word pure here. Since many commercial pomegranate juice products are heavily diluted or loaded with added sugar, which works directly against the cardiovascular benefit you're trying to achieve, reading labels carefully matters. Alternatively, a cup of fresh pomegranate seeds, sometimes called arils, provides a similar benefit alongside additional fiber that juice alone doesn't offer. And many of my patients find this a more satisfying, less sugar-dense way to incorporate this fruit into their daily routine. The second fruit I want to discuss is watermelon, which has become increasingly well known specifically for its citrulline content, an amino acid that your body converts through a distinct metabolic pathway into arginine, which in turn supports nitric oxide production through a mechanism that genuinely complements what we just discussed with pomegranate rather than simply duplicating it. Research examining citrulline supplementation has consistently found improvements in various measures of vascular function, including blood pressure regulation and arterial flexibility. More specifically relevant to today's conversation, several studies focused specifically on mild to moderate erectile dysfunction have found modest but measurable improvement in symptom scores among men supplementing with citrulline over a period of weeks. This effect appears to work through directly increasing the availability of arginine in your bloodstream, which your body then uses as raw material to produce additional nitric oxide, essentially feeding the same production pathway we discussed earlier from a different angle. Here's a detail that genuinely surprises most of my patients when I explain it. Watermelon rind, the white portion just beneath the red flesh that most people discard entirely without a second thought, actually contains a meaningfully higher concentration of citrulline than the flesh itself does. This doesn't mean you need to force yourself to eat the rind directly, though some people do blend it into smoothies specifically for this reason, but it's a genuinely interesting detail worth knowing. The flesh itself, the part everyone actually enjoys eating, still provides a meaningful amount of citrulline alongside excellent hydration and additional antioxidants, particularly lycopene, which offers its own separate, well-documented cardiovascular benefit through a different mechanism entirely, supporting healthy cholesterol levels and reducing oxidative stress in blood vessel walls. For a practical daily target, I generally recommend a couple of cups of fresh watermelon several times weekly, which comfortably aligns with the research showing measurable vascular benefit. For men who want a more concentrated, consistent approach, citrulline supplements are widely available and have their own body of supporting research. But I generally recommend starting with whole fruit first, both because of the complementary nutrients that come alongside it and because watermelon is simply an easy, enjoyable food to build into a regular routine without it feeling like a chore or a medical intervention. The third fruit I want to walk you through is blueberries, which bring yet another distinct but genuinely complementary mechanism to this overall conversation, this time through their exceptionally high concentration of flavonoid compounds, a category of antioxidant that blueberries are particularly rich in compared to most other commonly consumed fruits. This is where the research gets particularly compelling, in my opinion, because it doesn't rely solely on smaller clinical trials. Large population studies tracking tens of thousands of men over extended periods of time have specifically linked higher overall flavonoid intake, with blueberries consistently identified among the most concentrated dietary sources of these compounds to significantly reduced rates of erectile dysfunction. One particularly large, frequently cited study following a substantial population of men over several years found that regular consumption of flavonoid-rich fruits, blueberries specifically included alongside a handful of other sources, corresponded with a meaningfully lower risk of developing erectile dysfunction over the course of the study, even after researchers accounted for other relevant factors like overall diet quality, exercise habits, and body weight. The proposed mechanism behind this benefit involves improved endothelial function and better overall nitric oxide bioavailability, conceptually similar in principle to what we discussed with pomegranate's antioxidant protection, but achieved through an entirely distinct set of flavonoid compounds specific to blueberries. This is precisely why I think of these three fruits as complementary rather than redundant. Each one is supporting the same overarching vascular system, but through genuinely different biochemical pathways and mechanisms, which means combining all three provides broader, more comprehensive support than relying on any single one alone would. For a practical target, a cup of blueberries daily, whether fresh or frozen, both retain their beneficial flavonoid content quite well according to the research, represents a reasonable, well-supported goal that aligns closely with what's been used in the population studies showing this protective association. Frozen blueberries are a genuinely practical option here, since they're available year-round, tend to be less expensive, and work perfectly well blended into a morning smoothie or simply eaten thawed as a quick, easy snack. I want to pause here for a moment because understanding exactly which specific foods support which specific vascular mechanisms rather than relying on vague generic health advice is exactly the kind of practical, detailed guidance I built into a complete resource called the Iron Age. It walks through nutrition, testosterone, sleep, strength training, stress management, and prostate health, all with this same level of specific evidence-based detail, giving you an actual clear protocol to follow, rather than the vague generalities that dominate so much of men's health content online. For $49.99, that's genuinely less than the cost of a single specialist visit, and it's a resource you'll be able to reference for years as you continue optimizing your health across every one of these interconnected areas. If these videos have brought you real value, I genuinely encourage you to take a look. The link is below. Now, back to what we were discussing. What I find genuinely compelling about these three specific fruits and why I chose to highlight this particular combination rather than simply listing every fruit with some loose connection to cardiovascular health is that they support the exact same underlying vascular system through three distinct complementary mechanisms rather than three variations of the same mechanism. Pomegranate works primarily by protecting nitric oxide from breakdown once it's produced, extending its availability and effectiveness. Watermelon works by directly providing raw material in the form of citrulline that your body converts into additional nitric oxide production capacity. Blueberries work by supporting overall endothelial health and function through their unique flavonoid profile, improving your blood vessels' baseline capacity to produce nitric oxide efficiently in the first place. Combining all three, rather than picking just one and assuming that's sufficient, provides layered, comprehensive support across multiple points along this entire physiological pathway simultaneously. I found that patients who build all three into a regular weekly rotation, rather than fixating on just one, tend to report more noticeable, meaningful improvement than patients who rely on a single fruit alone, which makes complete sense once you understand that each one is addressing a genuinely different piece of the same underlying puzzle. I think it's worth spending a moment on the practical side of this, because understanding the research is only useful if you actually translate it into a sustainable habit. None of this requires a dramatic overhaul of your diet or any complicated meal planning. A simple, practical approach might look like this. Pomegranate juice or fresh seeds a few times weekly, perhaps as part of your breakfast routine or a mid-afternoon snack. Watermelon several times a week during warmer months when it's readily available. And a daily handful of blueberries, whether fresh in the morning with breakfast or frozen and blended into a smoothie. None of this needs to feel like a chore or a medical regimen you're forcing yourself through. These are genuinely enjoyable, naturally sweet foods that most men actually like eating, which makes long-term consistency considerably easier to maintain compared to choking down something unpleasant purely for its health benefits. I always tell my patients that the best intervention is the one you'll actually stick with consistently over months and years, not the theoretically perfect one you abandon after 2 weeks because it felt like a burden. I want to be genuinely honest with you about the limitations here because I never want to oversell a dietary intervention, no matter how solid the underlying research supporting it happens to be. These three fruits support the specific vascular mechanisms that erectile function depends on, and the research behind each one is genuinely solid, but they do not replace addressing underlying medical causes of erectile dysfunction. Cardiovascular disease, diabetes, low testosterone, and significant psychological factors like anxiety or depression all require direct medical evaluation and appropriate treatment, and dietary changes alone are unlikely to fully resolve erectile difficulty stemming primarily from these more significant underlying causes. This also isn't an overnight fix, and I want to set realistic expectations rather than letting you assume a single serving of any of these fruits will produce some immediate, dramatic transformation. The meaningful vascular benefits associated with regular intake of these fruits develop gradually over weeks and months of consistent dietary habits, not from an isolated meal or a few days of enthusiastic effort before falling back into old patterns. If you're currently experiencing significant persistent erectile difficulty that genuinely deserves a direct conversation with your doctor, including basic blood work checking your testosterone levels and blood sugar, alongside a broader cardiovascular assessment, given just how closely tied erectile function is to overall heart health, these three fruits work best as a genuinely valuable, evidence-supported piece of a broader, comprehensive approach, alongside regular exercise, adequate sleep, effective stress management, and directly addressing any underlying medical conditions with your doctor, rather than as a standalone solution you'd reasonably expect to resolve significant, established dysfunction entirely on its own. I want to address a practical question I get constantly from patients trying to build this habit sustainably. Does it matter whether these fruits are fresh, frozen, or even in juice form? And does the timing of when you buy and consume them affect how much benefit you actually get? For blueberries specifically, research has found that freezing preserves the vast majority of their flavonoid content quite well, meaning frozen blueberries purchased months after harvest still provide meaningful benefit, genuinely comparable to fresh ones in most studies that have directly compared the two. This is actually good practical news, since fresh blueberries can be expensive or simply unavailable depending on the season and your location, while frozen blueberries remain consistently accessible and often more affordable year-round. The same generally holds true for pomegranate, where frozen arils or high-quality bottled juice, provided it's genuinely pure without added sugar, retain meaningful antioxidant content. Watermelon is a bit different since it doesn't freeze and thaw particularly well in terms of texture, though the citrulline content itself remains stable. For watermelon specifically, I generally recommend focusing on fresh consumption during the months it's naturally in season and readily available, since this is when it's both least expensive and at its peak nutritional quality, rather than trying to source it out of season when quality and nutrient density tend to decline. I also want to directly address something that comes up frequently, and reasonably so, particularly among men who are also managing blood sugar concerns or working to manage their weight. These are, after all, fruits, and fruits do contain natural sugar. Is this a legitimate concern worth factoring into how much of these foods you consume? For the vast majority of men without diagnosed diabetes or significant insulin resistance, the modest amounts we've discussed today, roughly 8 ounces of pomegranate juice or a cup of arils, a couple of cups of watermelon several times weekly, and a daily cup of blueberries represent a genuinely reasonable amount of natural sugar, especially when consumed as part of an overall balanced diet rather than in addition to an already high intake of processed sugar from other sources. The fiber content in whole fruit, particularly in blueberries and pomegranate seeds, also meaningfully slows sugar absorption compared to something like fruit juice or processed sweets, reducing the blood sugar spike you'd otherwise expect from an equivalent amount of sugar consumed in a more processed form. That said, for men who are managing diabetes or significant insulin resistance, this is genuinely worth discussing directly with your doctor, since your appropriate intake may reasonably differ from the general recommendations I've outlined today. In these cases, I often suggest prioritizing whole pomegranate seeds over juice specifically, since juice removes the fiber that helps moderate the blood sugar response, and being more mindful of portion size with watermelon specifically, since it has a relatively high glycemic index despite its overall health benefits, meaning it can raise blood sugar somewhat quickly in isolation, even though the actual sugar content per serving is moderate. I think it's worth zooming out for a moment because I don't want you to walk away from this video thinking these 3 fruits are narrowly useful only for the specific topic we focused on today. The exact same vascular mechanisms we've discussed, nitric oxide production, endothelial function, protection from oxidative stress, are the identical mechanisms responsible for your broader cardiovascular health overall, including your risk of heart attack, stroke, and general cardiovascular disease as you continue aging. This is actually one of the reasons I find this particular topic so clinically meaningful, beyond the specific concern that brought most of you to this video today. Erectile function often serves as an early visible signal of your broader vascular health, sometimes appearing years before other, more serious cardiovascular symptoms become apparent. This means that supporting these exact mechanisms through diet doesn't just offer a narrow, isolated benefit, it's genuinely supporting your overall cardiovascular health and longevity simultaneously, which is precisely why I consider this one of the more valuable, efficient dietary interventions available, addressing multiple important health outcomes through a single, consistent habit. I want to set clear, honest expectations about timeline here, because I think this matters enormously for whether men actually stick with this long enough to see genuine results, rather than giving up after a week or two when nothing dramatic happens immediately. Based on the research we've discussed today, and what I've consistently observed clinically with patients who've built these habits consistently, most men begin noticing subtle early changes, slightly improved energy, perhaps marginally improved circulation noticeable in small ways, within 2 to 4 weeks of consistent daily intake. More meaningful, noticeable improvement in erectile function specifically tends to develop over a somewhat longer timeline, often in the range of 6 to 12 weeks of sustained consistent habit, since we're talking about gradually improving endothelial function and vascular responsiveness, a genuinely physiological process that takes real time to develop, rather than something that happens overnight from a single serving or even a single week of effort. I mention this specifically because I've had patients who tried this approach for a week, didn't notice any dramatic difference, and assumed it simply wasn't working for them. In nearly every case I've encountered, patients who stuck with it consistently for the full 2 to 3 month window did eventually notice meaningful, satisfying improvement precisely in line with what the underlying research would predict. Patience and genuine consistency matter enormously here, considerably more than most men initially expect going into this. I also want to be clear that these three fruits work considerably better as part of a broader, generally healthy lifestyle rather than as an isolated fix layered on top of habits actively working against the same vascular system we've spent this entire video discussing. Regular physical activity, particularly cardiovascular exercise, independently improves endothelial function and nitric oxide production through its own distinct mechanism, and combining consistent exercise with these dietary changes tends to produce considerably more noticeable complete results than either approach alone. Similarly, chronic smoking, excessive alcohol consumption, and poorly managed blood pressure or cholesterol all actively work against the exact vascular benefits we've discussed today, meaning the improvement from adding these fruits may be considerably blunted or even effectively canceled out entirely if these other significant factors remain unaddressed. I say this not to discourage you, but because I want you to have a genuinely accurate, realistic picture of how this fits into your overall health, rather than viewing it as a magic, standalone solution that operates independently of everything else happening in your body. Men who address this holistically, incorporating these fruits alongside reasonable exercise, moderate alcohol intake, and working with their doctor on any existing blood pressure or cholesterol concerns, consistently see the most complete, satisfying results across every measure we've discussed today. I want to leave you with something genuinely practical before we wrap up, because I've found that patients who have an actual simple structure to follow are considerably more likely to stick with this long term compared to patients who leave it vague and intend to eat more of these fruits when I think of it. A reasonable weekly approach might look something like this. Keep a container of frozen blueberries in your freezer at all times, since they're always available regardless of season, and add a cup to your breakfast, whether that's blended into a smoothie, mixed into oatmeal, or simply eaten thawed on their own, every single morning without exception. Treat this as a non-negotiable daily habit similar to brushing your teeth, rather than something you decide on fresh each day, since habits that require daily decision-making tend to fall apart considerably faster than ones built into a fixed routine. For pomegranate, consider keeping a bottle of pure, unsweetened pomegranate juice in your refrigerator or fresh pomegranate seeds during the months they're readily available, aiming for 4 to 5 servings weekly rather than necessarily every single day, which still comfortably aligns with what's been used in the supporting research. And for watermelon, simply enjoy it generously during the warmer months when it's fresh, flavorful, and inexpensive without feeling obligated to source it out of season when quality and value both decline. I want to emphasize one final time that this entire approach works precisely because it's simple, enjoyable, and genuinely sustainable, not because it's complicated or requires meticulous tracking. I've watched too many well-intentioned men build elaborate, complicated health routines that inevitably collapse within a few weeks, simply because they were too demanding to maintain alongside a normal, busy life. These three fruits succeed as a long-term habit specifically because they taste good, require no special preparation or equipment, and fit naturally into an ordinary daily routine without feeling like a medical intervention you're forcing yourself through. That simplicity is precisely what makes this approach genuinely different from so many overly complicated supplement regimens or restrictive diets that promise results but rarely deliver, simply because almost nobody sticks with them long enough to find out whether they would have worked in the first place. If there's one thing I want you to take away above everything else we've discussed today, it's this. Meaningful, lasting improvement in this area of your health doesn't require anything dramatic, expensive, or complicated. It requires understanding which specific foods genuinely support the exact biological processes involved, and then simply consistently showing up for that habit day after day, week after week, allowing your body the time it genuinely needs to respond. So here's what I want you to walk away with today. Pomegranate, watermelon, and blueberries each bring genuine, well-documented, research-backed support to the exact vascular processes that erectile function depends on, and they do so through 3 distinct but complementary mechanisms rather than simply repeating the same effect 3 different ways. Combining all 3 into your regular diet is a simple, accessible, evidence-based habit genuinely worth building, especially after 60, when your body's own natural vascular efficiency needs all the support it can reasonably get. None of this requires a dramatic lifestyle overhaul, expensive supplements, or complicated meal planning. It simply requires consistency, building these 3 enjoyable, naturally sweet fruits into your regular weekly routine, and giving your body the time it genuinely needs to respond to that consistent support. If this was useful, let me know in the comments which of these 3 you already eat regularly and which one you're planning to add. I'd love to know. And if you want more honest, research-backed conversations about men's health like this one, subscribe so you don't miss the next video. I'll see you there.